Hi everyone, I am Shahan Laik. Welcome back to my channel, Dr. Shahan's class, and here in this video, I will tell you about Usher syndrome. Usher syndrome is very important for NEETPG, FMGE, and also mrcp examination. Basically, in Usher syndrome, two types of sense organ are affected. Number one is ear and number two is eye. So in ear we get abnormalities and that led to our balance problem, and in eye we get abnormalities which led to retinitis pigmentosa. So what does Usher syndrome cause? Usher syndrome cause serious hearing loss and also eye disorder that worsen with time. So who is the first scientist or first doctor who gave this name Usher syndrome? It came from a British eye doctor. His name was Charles Usher. From the name Charles Usher, Usher syndrome came to be known. He was a British eye doctor. Basically, there are three types of Usher syndrome. Type 1 Usher syndrome, type 2 Usher syndrome, and type 3 Usher syndrome. Now, type 1 and type 2 are the most common type of Usher syndrome. Together, type 1 and type 2, they comprise the 90 to 95% of all the cases of Usher syndrome in children. So 90 to 95% of the cases, type 1 and type 2. Type 3 comprise only 5% of the cases. You can see the graph, only 5% is type 3. Now, let us discuss about type 1. People with type 1 are born deaf from the birth, okay? The person cannot hear anything. So, born deaf, type 1. And because the person is deaf, the person also have balance problem, and this is very severe balance problem. So if the person is deaf, if the baby is deaf at the birth and the baby is also having the balance problem from the very young age, that means the ear is affected very much, and later with time by the age of 10 the baby also develops vision problem that leads to blindness, that is type 1. So what happens? You can understand. Now what happens in type 2? In type 2 the patient is having severe hearing loss but normal balance. Hearing loss is also there in type 2 just like the type 1, but the balance is normal, and vision problem also develop in the early teens. So this is type 2, and this vision problem which develops, it develops later, it develops in early teenage. So it is very slow than that of the type 1. So it progress more slowly than type 1. Type 1 progress very fast. Type 1 will progress very fast, but type 2 will progress slowly. Now, what happens with type 3? In type 3, the people are born with normal hearing, normal balance. So, it is least severe kind. The person is having normal hearing, normal balance, and later in their life, the person develop vision problem and then hearing loss later in their life. So, this is type 3, which occurs only 5% of the people. So 5% of the people only have this type, where the person have normal balance, normal hearing at birth, and later develop the vision problem, and later after the vision problem develops hearing loss. So that is type 3. The major symptom of Usher syndrome are hearing loss and eye disorder. I told you, retinitis pigmentosa. And what happens in retinitis pigmentosa? Retinitis pigmentosa basically cause night blindness. Night blindness means what? You cannot see at night, or when there is poor light, when there is dim light, you cannot see properly. You can see the right side picture, how you can see in the night blindness retinitis pigmentosa condition. So Usher syndrome patient have retinitis pigmentosa, which can lead to night blindness, which lead to inability to see well in the night and poor light. Retinitis pigmentosa also cause peripheral vision loss. You cannot see the periphery, and later it progresses into tunnel vision. You can see tunnel like vision. And this Usher syndrome patient also have balance problem. Very, very important, they have balance problem. So you can see when this patient will be walking in the stairs or climbing up, climbing down, the person may fall down. So that is, the person is having balance problem. Always remember, Usher syndrome is inherited, which means it actually passes from the parents to the children by their genes. Now, what is the pattern of inheritance of Usher syndrome? Usher syndrome is inherited by autosomal recessive manner. What do you mean by the term recessive? Recessive means the person who have the Usher syndrome has a mutated form of gene from each of the parent. So both the parent has given each mutated gene and they are transferred to the child, and the child has Usher syndrome. So remember, if both the parents are carrier of a mutated gene for Usher syndrome, they will have 1 in 4 chance of having a baby who is having with Usher syndrome with each birth. Now, a parents may look normal, like the parent may have normal hearing, normal vision. They usually don't know that they may be a carrier of the gene of Usher syndrome. And when they come together, they live and produce a baby, and each mutated gene from each parent, from a mother, from a father, mutated gene comes together, it produces a baby with Usher syndrome. Early diagnosis of Usher syndrome is very, very important, because if we can understand the child is having Usher syndrome, then we can understand the child needs special care, special educational training program, because the child has to face hearing loss and vision problem together. Because Usher syndrome affects hearing, balance and vision, diagnosis of the 3 senses is very, very important for the evaluation or understanding of Usher syndrome. Now, is there any cure for Usher syndrome? Unfortunately, no. There is no cure for Usher syndrome. So what is the best treatment? Best treatment is early diagnosis of the condition, that the patient, that the baby is having Usher syndrome, that the child is having Usher syndrome. We need to early diagnose it, and accordingly we have to train the baby. Accordingly we have to give special training for the educational purpose of the baby. Other treatment option can be, number 1, hearing aids, which is given to the baby or the child, assisted listening devices, cochlear implants, teaching of other communication method like American Sign Language. You can teach the baby by American Sign Language, or you can use Braille. What is Braille? Braille is a system where the blind people, they can understand by touching on the paper. The papers has certain dots which are raised so that the person, blind people, can feel it and understand. So these are the methods. Another thing which is also recommended sometimes is to provide a very high dose of vitamin A to slow the progression of the RP, to slow the progression of the retinitis pigmentosa which the patient is suffering. We may give vitamin A. vitamin A dose can be given, but there are some problems associated to vitamin A also, and it need proper research. We are not sure 100% how much it can work, so it need further research, and the doctor who is in supervision, he will decide if this vitamin A dose is to be given to the child or not. Generally, 15,000 international unit of vitamin A is given under the supervision of an eye specialist doctor, and this 15,000 international unit is given daily so that we can decrease the progression of the RP, progression of the retinitis pigmentosa to some extent, and this is given in the supervision of an eye specialist doctor. But high dose of vitamin A is not recommended for patients with type 1 Usher syndrome. Remember, type 1 was very severe one. So type 1, and 95% of the people have type 1 and type 2. I already told you. So type 1 patients should not be given high dose of vitamin A. It is not recommended basically. This is because research need to be done for the effect of vitamin A on the people of type 1 Usher syndrome, and we have to find out that whether this high dose of vitamin A is working properly in type 1 Usher syndrome patient or not. We have to understand. So more research need to be done. So this is the end of this video. If you like this video, make a thumbs up and please subscribe this channel. This channel contains so many medical videos on diseases free of cost. You don't need to pay a single rupee to watch these videos. These are completely free. You just need to hit the subscribe button, and please write down in the comment section below if you like this channel, like this video. Thank you. Have a nice day. Bye bye.